Let us begin with the medical coding guideline of the respiratory system, and for the better understanding I have divided this system into different parts. So let us begin with the part 1. Now, when you begin with a new section, always take some time to study that section, how the section has been placed or how the section has been designed. Now, this is the 30,000 series, and in that we are going to study the respiratory system, which is still the 30,000 to 33,000, and then we have cardiac system, the cardiac system also. Now, in the respiratory system, you will see that we have the the main organs of the respiratory system, and then there are certain subsections which are divided depending upon the treatment we carry out on that, and there is a color coding for the heading, and then these are the subsection, and you will see that the subheadings are pretty much the same for all the organs, and you must study this carefully so that it will help you to navigate that particular section easily. So for the better understanding, we always divide the respiratory system into the upper respiratory tract, which mainly consists of the nose, sinuses, throat and larynx, and the lower respiratory tract, which mainly consists of the trachea, bronchi, bronchioles and lungs. And we pretty much will follow this format for the better understanding. So this is a snapshot of the book where you will get clear-cut understanding that incision, excision, introduction, removal, repair, destruction and other procedure related to the nose are divided in your book, and you can just go through it so that you will get good idea about the book. So we'll cover nose and accessory sinuses in this part. Now, these are the important medical terminology which are related with this particular chapter. And nose, naso, intranasal, that is within the nose. Rhino is also nose, and this particular rhino is originated from the rhinoceros, who has also a characteristic horn on his nose. And rhinoplasty is repair. Whenever we use the word plasty, it is repair. Then pharynx, pharyngeal, pertaining to the pharynx, larynx, laryngospasm, that is a spasm of the larynx. You also try and make one more terminology with all these words like laryngotomy, laryngoscopy, then the trachea, that is tracheostomy. Stoma is creating the opening into the particular organ. Then broncho is a bronchus, bronchogenic, that is originating in the bronchus or bronchoscopy or bronchodilator, and then the bronchioles, that is bronchiolactasis, that is a dilation of the bronchioles. So these are some important terminology I have covered here. Just go through. So there are some more important terminology like a phrena is a diaphragm and phrenic is pertaining to the diaphragm. Then the phrenic nerve is or the phreniectomy, that is a partial excision of the phrenic nerve. Phrenic nerve is basically the nerve which supplies to the diaphragm, and ectomy is you have excised. Anything it is ectomy is excised or removed. Then the pleura is basically pleurodesis is the fusion of the pleura. Now, if I use the word arthrodesis, I am talking about the fusion of the bone. Now, the lung is extrapulmonary, outside the lungs. So the lungs are also called as a pulmon, and lungs are also called as a pneuma. Pneuma is another word for the air, and pneumonitis is the inflammation of the lungs, which is more commonly known as a pneumonia. And then pneuma is the air, gas, also the respiration and the lung. Pneumothorax is the presence of the air into the thoracic cavity, is called as a pneumothorax. And if I say the hemothorax, I am talking about the blood in the thoracic cavity. Then spiro is the breathing, and spirometer is the instrument for measuring the breathing volume. So these are the terminology pertaining to the respiratory system, but you can use it to make some more medical terminology for your better understanding. So let us begin with the nasal polyps. And in this case, you have the code for the simple, you have the code for the extensive, and then you have the code for the excision or the destruction of the intranasal lesion. How do you carry out the approach? So the important thing here is, if you read the language of this code, you can use this code for the single polyp or the multiple polyps, but I will use this code only once. And remember, these codes are unilateral, especially this code and this code. These codes are unilateral, and that's why I see this parenthetical note. For the bilateral procedure, I'll have to use the modifier 50. So just make that important observation that these codes are unilateral code, and for the bilateral we put modifier. So what CPT code are reported for extensive excision of the 7 nasal polyps, and we have 4 options. So let us eliminate the wrong option. Now the 30110 talks about the simple excision, and in our patient case it is extensive. So automatically we will delete the option B. Now I told you that whether it is a single or multiple, we'll be using this code only once. That eliminate option C also. And this is not the correct way to write the code. So remember that all these 3 codes are not the correct code, and let us finalize our. So our answer is 30115. And what was the guideline? Irrespective of the number of the polyps, we will code it only once. Now the next important is excision code for the turbinate surgery, and here the important thing is the code is specifically for the submucal resection of the inferior turbinate, and here this is a very important the guideline. For the excision of the superior and middle turbinate, we use the code 30999, so that you have to pay attention to. Let us take one more question. A 6-year-old boy with a complaint of pushing a wooden piece into the left nostril while playing. ENT physician examined the baby and tried to remove the mass with the instrument, but of no use. Since the boy was not cooperating, ultimately the physician has to perform the procedure under general anesthesia. And we have all this code. You eliminate all the wrong code to get the correct answer. So if you see 30110, it talks about the polyps, and here it is the removal of the foreign body because there was a wooden piece. So we will eliminate 30110. Then 30320, it talks about the lateral rhinotomy. That nothing like that has happened in the patient. So we will eliminate that. Now in between the two, let us see what's the correct code. So you have the two options. 30300 is the removal of the foreign body intranasal, but office type of procedure. And 30310, it is an indented code which talks about requiring the general anesthesia. So I will read removal of the foreign body intranasal requiring a general anesthesia. And that's what happened in our patient, and that's why we are zeroed in the answer D. So the next important topic is rhinoplasty, that is repair of the nose. So the rhinoplasty changes the shape or the appearance of the nose. It can be performed to correct the birth defect, improve the breathing, or enhance the facial harmony. Now, one important guideline here is all the rhinoplasty codes include repair. So there is no need to code separately for the repair from the integumentary system. Very important guideline. Now these are the code for the septoplasty. So what is septoplasty? Is nothing but correction of the deviated nasal septum, the cartilage that separate the nasal passages. So there is a cartilage here, and when we try to do something with that, it is called as a septoplasty, or it is also called as a submucosal resection. And these are the code for that. Pay attention to the parenthetical note wherever they are written. So this 25-year-old male present with a deviated nasal septum. After intubation, the left hemitransfixion incision was made with the elevation of the mucoperichondrium. The cartilage from the bony septum was detached and the nasoseptum was realigned and removed in a piecemeal fashion from the obstructed perpendicular plate of the ethmoid. Thereafter, 40 chromic was used to approximate mucous membrane. Next, submucosal resection of the middle and inferior turbinate was handled in the usual fashion by removing the anterior third of the bony turbinate and lateral mucosal, followed by the bipolar cauterization of the posterior enlarged tip of the inferior turbinate as well as the outfracturing. A small amount of the silver nitrate cautery was used to achieve hemostasis. A dressing consists of the fold of telfa with a ventilating tube for nasal airway on each side achieved good hemostasis. Patient went to recovery in good condition. What is the correct CPT code for this process? So first of all, we need to find out what has happened. Here there was a surgery on the deviated nasal septum. So let us eliminate the wrong answer. Now the 420, it is including the major septal repair, it is a indented code. Now 620, it is a dermatoplasty. The derma is a skin, plasty is a repair. Dermatoplasty didn't happen in our patient case. Neither the 30450 because it talks about the rhinoplasty. Because this is a indented code and that's why you will see that this is the rhinoplastic code. So that didn't happen. Dermatoplasty didn't happen. So 30450, 30620 goes away. Now we have 420 and 520. So let us see the answer. So the answer is A because it talks about the septoplasty or submucosal resection with or without cartilage scoring, contouring or replacement with the graft. So let us take one more example. Patient nose was hit with a baseball during the high school baseball game. At that time, the reconstruction was performed with a local graft. Patient returns now as an adult, discontent with a bony prominence along the bony pyramid and flat look at the tip of the nose. He underwent major revision with osteotomies and nasal tip work. At the end of the surgery, the incisions were closed with a single layer technique. So what CPT code is reported? Now let us look at our option. 30410, it is an option for the primary rhinoplasty. Now in this case, this is the rhinoplasty that they are doing it again. So it is a major revision and we have this major revision with the osteotomies. So we will require a code 30450. 30462, it is also the rhinoplasty code, but it talks about the rhinoplasty when it is done during the secondary to congenital cleft lip problem. That is, you will do that rhinoplasty whenever the deformity is because of the second congenital problem. So we will definitely not require that code. Now the 30450, so we will have B and C option, and in the B option you will see 12040. Now we know the guideline that in the rhinoplasty repair is included and we do not code separately for that. So our final answer will be C. Now the next question, the patient underwent a surgical procedure to repair a nasal vestibular stenosis, specifically addressing the right side to elevate the obstruction and improve the airflow. What CPT code is reported for the procedure? Now we have this code 30465. It talks about the repair of the nasal vestibular stenosis, and that's what exactly happened in our patient case. And so we will require the code 30465. 30620, it is a septal or the other intranasal dermaplasty, basically the skin repair. That didn't happen in our case. And 30520, it is a septoplasty or submucosal resection with or without cartilage scoring, contouring or replacement with a graft. So many a time you will have to check what procedure has happened, and here it is a repair nasal vestibular stenosis. Now we will find out in between A and C what is the correct option. So option C is the correct answer because there is a note below 30465 that if it is used to report a bilateral procedure, for a unilateral procedure use the modifier 52, and in our patient we have done this surgery only on the right side. So all through this chapter, whenever you are coding, pay attention to the code language. Like for example, in this case, when you are using the nose code, everywhere pay attention whether this code is for the bilateral or unilateral, and for that Your reading the parenthetical notes is at most important for you, because then only you will code it correctly. Roger had a rhinoplasty to correct the damage caused by the broken nose. 1 year later, he had secondary rhinoplasty with a major revision. At the end of the secondary surgery, the incisions were made with a single layer technique. How would you report the second procedure? Now, in this case, first the drill is what procedure has been done. It is a rhinoplasty. So we will concentrate on picking up the code which talks about rhinoplasty. Now the code 30430, it is a rhinoplasty secondary. Yes, that has happened, but it talks about minor revision. So in our patient case, it is a major revision. So we cannot pick up the code 30430. The second code is 30420. It is including major septal repair. This is the code for the rhinoplasty primary. And in our case, it is a secondary. Secondary means the first rhinoplasty happened, and when you are doing again, it is called as a secondary. So even 30420 is not the right code. 30450, it is the rhinoplasty secondary major revision, and that has happened. So we will pick up the code 30450. Now in between A and B, the B has a modifier 78. The modifier 78, we write whenever the patient comes back during the post-operative period due to some problem related to the procedure. Now the patient had a problem, but that problem was 1 year back. Now remember that the maximum post-operative period is never more than 90 days. Okay, so and this is like 365 days, because 1 year later he came. So we cannot even use the 78 modifier here. So the answer is 30450. The answer is A. Next important topic is epistaxis. Epistaxis is nothing but nosebleed. It is a common condition that occurs when the blood vessel in the nose bursts. Now, as far as the epistaxis codes are concerned, we always divide the epistaxis into the anterior nosebleed and the posterior nosebleed. And the code language is very clear that this is the anterior, and again it is a simple or whether it is a complex, that is extensive. And how do you stop that epistaxis? Control nasal hemorrhages posterior with a posterior nasal pack. And second important thing, you must know that all these codes are unilateral. How do I get to know? Because here there is a note. To report the bilateral procedure, use the modifier 50. So kindly, all through the CPT book, you must pay attention to the parenthetical note. As far as this chapter is concerned, it is giving you a lot of indication whether that particular procedure code is unilateral or bilateral. So let us take one example. 43-year-old female is seen in the emergency room with a severe epistaxis. She said this is common occurrence for her during the cold dry months of winter, and this is why she is here for the third time this week. Extensive bilateral posterior cautery and packing is again required to control the hemorrhage. What CPT code is reported? Now look at the code 30905. It talks about control nasal hemorrhage posterior with a posterior nasal pack and a cautery. And that definitely happens in our patient case. Extensive bilateral posterior cautery. So we will require a code 905. And that eliminates the option 903 because it is a control nasal hemorrhage anterior. In our case, it is a posterior. So B goes away, and 906, it talks about the subsequent. So we need to find out, because this talks about the initial visit, this talk about the subsequent visit. Now we will have to check the answer. So the correct answer is answer D. Why? Because she has come. She is here for the third time this week. So it is a subsequent visit. So 30906, that we are going to write. And again, this is a unilateral code. For the bilateral procedure, we will require the modifier 50. So the answer D is the correct answer. Now the next important organ is a paranasal sinuses. There are four pairs of sinuses. Remember, these are four pairs. All are bilateral. So here it is a frontal sinus. Then you will have a maxillary sinus, and then you will have a ethmoidal sinus, and then you will have a sphenoidal sinus. So what you can see in front is mainly the frontal and maxillary sinus. Now the codes 31233 and 298 are used to report the unilateral procedure unless otherwise specified. So modifier 50 for the bilateral procedure. Again the same thing. In the maxillary sinuses also pay attention whether it is a unilateral or bilateral code, and that information we will get by the parenthetical note. So we always carry out the sinus endoscopy. Now what are the two important guidelines? Codes are for the diagnostic evaluation and surgical endoscopies. A surgical sinus endoscopy includes the sinusotomy. Sinusotomy means basically creating an opening for the scope to go in. And it always, so whenever you are doing the endoscopy, the sinusotomy is always included, and even the diagnostic endoscopy. And that is true for all the scopies, that whenever the diagnosis is carried out and the surgical carried out in the same sitting, we only code for the surgical. Now anytime the diagnostic evaluation is performed, all the areas like nasal cavity, meatus, turbinates are inspected and separate code is not written. But in case the area is not clinically pertinent or precluded due to the technical issue or altered anatomy, then we use the modifier 52 if the repeat examination is not planned, and modifier 53 if repeat examination is planned. So these are very important guidelines. So the patient is seen in the endoscopy suite for the diagnostic maxillary sinusotomy. During the sinusotomy, the provider observes some diseased tissue which needs to be removed. The provider decides to perform the maxillary enterostomy with a tissue removal. Bleeding is controlled. The patient tolerated the procedure well. What CPT codes are reported? And here your options are there. So we will eliminate the wrong option. 31231 nasal endoscopic diagnostic. Now the diagnostic, they started with the diagnostic, but they ended with the performing the surgical, because they have done the surgical also, because they found out some diseased tissue which needs to be removed. So it ended up converting into the surgical. So this is a very important clue for you. Now, what is our guideline? That whenever the diagnostic and surgical happen in the one sitting, we code only for the surgical. So here the option A is not the correct option. Now we will see 254 and 256. 254 talks about ethmoidectomy, that is removal of the ethmoid sinus. That didn't happen in our patient case. So the option B, 254 is not the correct code. So we will eliminate option B. Now in between C and D, let us see what's our option. So D is the correct option, because the code 31267 is an indented code, and to read the code I am going to read the above code: nasal sinus endoscopy surgical with a maxillary enterostomy with removal of the tissue from the maxillary sinus. That's what exactly happened in our patient's case. Let us take one more example. A patient with a diagnosis of the chronic sphenoidal sinusitis undergoes a bilateral sinusotomy. While the provider examines the diseased sphenoidal sinus, she takes a biopsy of the sphenoidal masses and removes the mucosa with several polyps. Transseptal sutures are placed and the intraoral incision is closed in single layer. The nose is packed and the external nasal dressings are placed. What CPT and ICD codes are reported? Now we have this code. Now, whenever you are doing any question related to the sinus, first of all, we need to find out how the procedure is carried out, whether it is by the scopy or whether it is by the open surgical method. Now, if you take this particular question, there is no mention of the word endoscope, and there is a mention intraoral incision, transseptal sutures, and so that gives me enough clue that this is not an endoscopy procedure. So first of all, 31237, it is a nasal sinus endoscopic surgical. Now in our case, it is not a endoscopy. So we will have to eliminate all the wrong option. Now 31288. 31288 is also nasal sinus endoscopy surgical with sphenoidotomy and with the removal of the tissue from the sphenoid sinus. But of course, this is what happened, but this is happened endoscopically. In our patient case, it happened by the surgical means. Now 310, 90, it is a cynostomy, unilateral 3 or more paranasal sinuses, frontal, maxillary, ethmoidal and sphenoidal. And we have the code 31051. It is a cynostomy, sphenoid with or without biopsy, with a mucosal stripping or removal of the polyp. So we will check what's the answer. So D is the correct answer because it talks about the cynostomy sphenoid with a biopsy, with a mucosal stripping or removal of the polyps, and we will put a modifier 50 for the bilateral procedure. Let us take one example. The patient suffering from chronic inflammation of the maxillary sinus underwent a surgical endoscopic transnasal balloon dilation procedure to restore normal sinus function. During this procedure, maxillary antrostomy with a removal of the tissue was completed. How should you report the procedure? And we have this code 31295, which talks about the surgical endoscopy with a dilation, maxillary sinus ostium, transnasal or via canine fossa. And below that, there is an important parenthetical note: do not report 31295 in conjunction with 31233, 256 and 267. So we have a 256 and 267 and we cannot code this 31295 with this code. This parenthetical note is important. That automatically eliminates option B and C. And we have left with option A and D. And option 31297 talks about sphenoid sinus. And in our case, it is a maxillary sinus. So that gives us answer A is the correct answer. Patient has an endoscopic surgery done to remove his anterior and posterior ethmoidal sinuses. The surgeon dilated the maxillary sinus with a balloon using the transnasal approach, explore the frontal sinuses, remove the 2 polyps from the maxillary sinus and then perform the tissue removal. So here what has happened is there is a ethmoidectomy happen. And how did it happen? It is by the endoscopic surgery. So we will require first code for that. And if you see the code 31255, it is the code for the endoscopy surgical with the ethmoidectomy and partial or total. In our case, it is a total because anterior as well as the posterior ethmoid sinus has been removed. So I will require a code for 31255. Now, if you see all other codes, there are many parenthetical note, and that parenthetical note will help you to exclude many options. So like for example, 31237, it is the code with the endoscopy surgical with a biopsy, polypectomy or a debridement. And here below that they have written that do not report 31237 along with 31255. So we cannot take the option A. 31201, it is a excision, that is the surgical procedure without a scope. So I cannot even think about option B. Now in between C and D, option D is 31255. Definitely we are taking. 31295 is the uh, endoscopy surgical with a dilation, balloon dilation, maxillary sinus ostium, transnasal or via canine fossa. So we will definitely require this code. But wait, there is a note below that do not report 31295 in conjunction with 31233, 256, 267. So even here, this and this can't be together. So even this is the wrong option. So we can eliminate all the wrong options by just reading and nullifying all those particular options, and we are held with only one option, that is C option. And if you see what is this, this talks about the ethmoidectomy, and 267 it talks about with removal of the tissue from the maxillary sinus. And here also again check whether the 267 can it be coded with 255. Yes, it can be coded because that code is not written here, and that's why C will be the final answer.